I didn't make my decision until the end of third year or early fourth year. Hello YouTube friends, welcome back to my YouTube channel. My name is Leena and I'm a fourth year medical student in the United States. Today we're going to talk about a big topic, how to choose your medical specialty. If you feel overwhelmed when you hear this topic, you're not alone. I've definitely been there. It is a huge decision to make in a short amount of time, so I understand the pressure. In this video, I'm going to go through some of the tips that really helped me and my peers decide on our specialty of choice. The first thing is to know yourself. You have to have a really good sense of what your personality is like and what your preferences are. Do you want to work in an urban, suburban, rural area? Do you really like the adrenaline thrills in emergency medicine? Or do you really enjoy more methodical thinking and detail-oriented and enjoy specialties like internal medicine or pathology? One great tool to help you assess what your preferences are is the residency preference exercise listed on the AAMC website. It's a free resource to help you figure out what are some of the things that are important to you when deciding on your specialty of choice. Second thing is to explore everything. During your third year rotations, you will go through the core specialties, including internal medicine, surgery. However, you won't get a chance to be exposed to everything like ophthalmology or ENT. So it's really important for you to look for opportunities and shadow people in those specialties if you think you might be interested early on in medical school, especially during first and second year. I personally came into medical school thinking I might do psychiatry, neurology, and I shadowed all of these specialties, thought about dermatology and shadowed dermatologists, but ended up not liking them as much as internal medicine. Make sure to keep an open mind because you'll never know what specialty surprises you at the end. Third thing is questions to ask yourself when you're in your third year doing your core rotations. First question is, do you prefer an inpatient or outpatient setting? Inpatient meaning being in the hospital for your shifts, or outpatient having a regular 8 to 5 seeing patients on interval basis, 20 minutes at a time usually. Second question to ask yourself is, do you like surgery, or are you okay not being in the OR all the time? There are a lot of specialties out there that have a lot of procedures like GI and dermatology that don't require you to be in the OR all the time. Third question is, do you like the more acute settings in the hospital? You might enjoy ICU or the ED more than anything else. Or do you like treating chronic conditions in people and counseling them and providing education on certain chronic diseases? Fourth thing is, think about the worst thing in that specialty. You can talk to people who are already in that specialty and learn about what they dislike the most. Are you okay with dealing with that for the rest of your life? Remember, for these 4 questions, there's often no clear-cut answer. A lot of specialties have a combination of all of these things. Asking myself these 4 questions when I am exposed to a certain specialty, when I'm shadowing, or when I'm on my core rotations really helped me narrow down my choices. Fourth thing is mentors, mentors, and mentors. I cannot emphasize this enough. Talk to people already in this field. Learn what their day-to-day is like. Ask them what are some of the biggest challenges in this field. I remember shadowing a cardiologist during my first year of medical school. Since then, she has been my mentor every step of the way, not only providing me career guidance, but also life guidance. Fifth thing is, think about your lifestyle. Lifestyle truly matters. Are you okay with working 80 hours a week for the field that you're especially passionate about? Or do you want to balance your time with some other hobbies and interests in life, as well as giving more time to your family and friends? Some specialties definitely demand your time more to be in the hospital, while some other specialties offer more flexibility. It's important to choose what aligns with your core values. Last but not the least, don't rush their decision. You might want to talk to your friends and family, as well as your advisors and people in the field to decide what this specialty you want is, but ultimately it is your decision and it is okay to take time to figure out what is best for you. I didn't make my decision until the end of third year or early fourth year. So remember, there is no wrong choice. Choose something you love and you'll never look back. Hit that like button if this helps. Don't forget to subscribe to my channel if you want more content as such for medical school and for pre-med. Drop a comment down below on what specialty are you deciding to go into, or which choices are you debating between. I would love to hear where you're heading.